Introduction. A stroke, also known as a cerebrovascular accident, CVA, is a medical condition that occurs when the blood supply to the brain is interrupted or reduced, depriving the brain of oxygen and nutrients. This can lead to damage or death of brain cells, resulting in a range of cognitive, motor, and sensory impairments. Stroke is a leading cause of disability and death worldwide, and it is essential to understand the causes, symptoms, and treatment options to provide optimal care for individuals affected by this condition. Types of stroke. There are three main types of stroke. 1. Ischemic stroke. This is the most common type of stroke, accounting for approximately 87% of all stroke cases. Ischemic stroke occurs when a blood clot or thrombus forms in a blood vessel, blocking the flow of blood to the brain. 2. Hemorrhagic stroke. Hemorrhagic stroke occurs when a blood vessel in the brain ruptures, causing bleeding into the surrounding tissue. This can lead to damage to brain cells and tissue, as well as increased pressure within the skull. 3. Transient ischemic attack, TIA. A TIA, also known as a mini-stroke, is a temporary interruption of blood flow to the brain that lasts for less than 24 hours. While the symptoms of a TIA are similar to those of a stroke, they are typically reversible, and the individual returns to normal within a short period. Causes of stroke. The causes of stroke can be divided into two main categories. 1. Ischemic stroke causes. Ischemic stroke can be caused by a blood clot that forms in a blood vessel, or by a blood clot that breaks loose from another part of the body and travels to the brain. 2. Hemorrhagic stroke causes. Hemorrhagic stroke can be caused by a ruptured aneurysm, a weakened blood vessel, or a head injury. Risk factors for stroke. Several risk factors can increase an individual's likelihood of experiencing a stroke. These include: 1. Hypertension. High blood pressure is a significant risk factor for stroke, as it can damage blood vessels and increase the risk of clot formation. 2. Atrial fibrillation. Atrial fibrillation is a heart condition characterized by an irregular heartbeat, which can increase the risk of clot formation and stroke. 3. Diabetes. Diabetes is a risk factor for stroke, as it can damage blood vessels and increase the risk of clot formation. 4. High cholesterol. High levels of low-density lipoprotein, LDL, cholesterol can increase the risk of clot formation and stroke. 5. Smoking. Smoking is a significant risk factor for stroke, as it can damage blood vessels and increase the risk of clot formation. 6. Family history. A family history of stroke or other cardiovascular diseases can increase an individual's risk of experiencing a stroke. Signs and symptoms of stroke. The symptoms of stroke can vary depending on the location and severity of the damage. Common symptoms include: 1. Weakness or numbness in the face, arm, or leg, typically on one side of the body. 2. Difficulty with speech. Difficulty speaking or understanding speech, including slurred speech or confusion. 3. Vision changes. Vision changes, including blurred vision, double vision, or loss of vision in one or both eyes. 4. Dizziness or loss of balance. Dizziness or loss of balance, which can increase the risk of falls. 5. Severe headache. A severe headache, often described as the worst headache of the individual's life. FAST test. The FAST test is a simple and effective way to identify the signs of a stroke. FAST stands for: 1. Face. Ask the individual to smile. Does one side of their face droop? 2. Arm. Ask the individual to raise both arms. Does one arm drift downward? 3. Speech. Ask the individual to repeat a simple sentence. Is their speech slurred or difficult to understand? 4. Time. Time is of the essence. If the individual shows any of these symptoms, call for emergency medical services immediately. Diagnosis. Diagnosing stroke typically involves a combination of physical examination, medical history, and diagnostic tests. These may include: 1. Physical examination. A physical examination to assess the individual's neurological function, including their strength, sensation, and reflexes. 2. Medical history. A medical history to identify any underlying conditions that may have contributed to the stroke. 3. Imaging tests. Imaging tests, such as computed tomography (CT) or magnetic resonance imaging (MRI), to visualize the brain and identify any areas of damage. 4. Blood tests. Blood tests to identify any underlying conditions that may have. Treatment. The treatment for stroke depends on the type and severity of the stroke, as well as the individual's overall health. Treatment options may include 1. Thrombolytic therapy. Thrombolytic therapy involves administering medications that dissolve blood clots, restoring blood flow to the brain. This treatment is typically used for ischemic stroke. 2. Mechanical thrombectomy. Mechanical thrombectomy involves using a device to remove the blood clot from the blood vessel, restoring blood flow to the brain. This treatment is typically used for ischemic stroke. 3. Surgery. Surgery may be necessary to repair damaged blood vessels or relieve pressure within the skull. 4. Medications. Medications may be prescribed to manage symptoms, prevent complications, and improve outcomes. Rehabilitation. Rehabilitation is an essential component of stroke recovery, as it helps individuals regain lost functions and adapt to any permanent changes. Rehabilitation may include 1. Physical therapy. Physical therapy to improve mobility, strength, and balance. 2. Occupational therapy. Occupational therapy to improve daily functioning and independence. 3. Speech therapy. Speech therapy to improve communication and swallowing. 4. Cognitive therapy. Cognitive therapy to improve memory, attention, and problem solving. Prevention. Preventing stroke involves managing risk factors and making lifestyle changes. These may include 1. Controlling hypertension. Controlling high blood pressure through lifestyle modifications and medications. 2. Managing diabetes. Managing diabetes through lifestyle modifications and medications. 3. Quitting smoking. Quitting smoking to reduce the risk of stroke and other cardiovascular diseases. 4. Exercising regularly. Regular exercise to improve cardiovascular health and reduce the risk of stroke. 5. Eating a balanced diet. Eating a balanced diet that is rich in fruits, vegetables, and whole grains. Complications. Stroke can lead to a range of complications, including 1. Cognitive impairment. Cognitive impairment, including memory loss and difficulty with problem solving. 2. Physical disability. Physical disability, including weakness, numbness, and paralysis. 3. Emotional disturbances. Emotional disturbances, including depression and anxiety. 4. Swallowing difficulties. Swallowing difficulties, which can increase the risk of aspiration pneumonia. 5. Seizures. Seizures, which can occur in some individuals after a stroke. Prognosis. The prognosis for stroke varies depending on the type and severity of the stroke, as well as the individual's overall health. Some individuals may make a full recovery, while others may experience persistent cognitive, motor, and sensory impairments. With prompt medical attention and rehabilitation, many individuals are able to regain lost functions and adapt to any permanent changes. If this lecture helpful to you, please like, share, subscribe, and comment me for new topics.